Distinguished Honorable Speaker and National Assembly members, thank you for inviting my team and I to this extraordinary session of the National Assembly on the death of children due to acute kidney injury. I acknowledge the presence of the Honorable Ministers, my colleagues, and the bereaved families who are here with us to be part of this process, and other distinguished individuals who are gathered here. We would like to extend our sincere condolences to all the families affected, all the families who have lost their loved ones, and we pray that Allah grants all the departed children Al-Jannatul Firdaus. This period has been very difficult for the families of the children, and we pray that Allah grants them the fortitude to bear the loss. It has been a very difficult period for all the people, the families. We were in the hospitals with them. We saw their struggles. We saw their pain. Each time I visited the patients at the hospital, we saw the anxiety, the fear, the pain on the faces of the families. We understand what you went through. But only Allah can comfort you, and we pray that Allah comforts all of you. But we want to tell you that we share your pain. We have been in it together from the beginning. As an honorable member said here, our work is to save lives with the help of the Almighty Allah, and we've been doing that to the best of our ability. When we lose lives as health workers, we quietly cry. Sometimes we hide behind and we cry as much as the families. And in this case, we all cried quietly with you each time you lost a family member. At this juncture, Honorable Speaker, we also wish to commiserate with the health workers who were taking care of these patients and did all they could do to save their lives, but ended up losing them. This year, the Gambia experienced the highest amount of rainfall in over 15 years. There had been windstorms, floods in many parts of the country. There are numerous diseases that become common during the rainy season, either because the vectors carrying such diseases or disease-causing microorganisms thrive and reproduce well in stagnant rainwater, or such water serve as conduits for the transmission of waterborne diseases. These diseases could be viral, bacterial, or parasitic. For this reason, each year during the rainy season, diseases such as cholera, salmonellosis, or other bacterial diarrheal diseases and viral diarrheal diseases, also malaria, skin diseases, etc., are all commoner during the rainy season. This year is no exception. Floods are known to worsen this problem, and that is one of the most important causes of mortalities when it comes to floods. The fact that there could be physical injury to the flood victims, coupled with the high potential of disease outbreaks. That is why governments and health systems are concerned when floods arise. In July 2022, the Ministry of Health received information from the doctors at the Pediatric Department of the Edward Francis Small Teaching Hospital, that is EFSTH, that they were seeing an increased number of children under 5 years who were presenting with symptoms of acute kidney injury. This information was conveyed to the Epidemiology and Disease Control Unit of the Ministry of Health, whose mandate it is to conduct surveillance and control diseases of public health concern. An incident management system was set up to look into the AKI issue. Acute kidney injury, or AKI, is the sudden deterioration of the functions of the kidneys, which manifests with the symptom of oliguria, that is diminished urination, or anuria, production of no urine at all, among others. The injury to the kidneys may affect other homeostatic functions of the kidneys. This may coexist with or lead to other organ damage. Acute kidney injury can be classified as community-acquired acute kidney injury or hospital-acquired acute kidney injury. Every country has a baseline level of acute kidney injury. These figures vary from one geographical location to the other, from country to country, and from one health facility to the other within the same country. Acute kidney injury in children has numerous causes. These causes can be broadly classified into three: pre-renal, renal, and post-renal. Renal referring to kidneys. The pre-renal causes of acute kidney injury in children, especially in the tropics, include acute gastroenteritis, which is usually associated with severe vomiting and diarrhea, complicated malaria, sickle cell disease and its complications, severe dehydration of whatever cause, and sepsis, that's infections, severe infections in children. The renal causes, those are causes that are inherent in the kidney itself. Acute tubular necrosis, acute hemolytic uremic syndrome, glomerulonephritis, the various forms. Factors causing this could be from nephrotoxic medications, from toxins, and again from severe infections. The post-renal causes, those are causes that are beyond the kidney but end up causing acute kidney injury. Factors that block the ureters, the bladder, or the urethra. These could be stones in the urinary tract. They could be tumors and congenital malformations, etc. From the outset, it was clear that the possible causes of acute kidney injury in these children were many. Most of these children had a history of diarrhea and vomiting, fever, and some of them had cough. These children were referred from all 6 health regions of the country. These were the regions where the floods had been reported. The only region where there was no referred case was the North Bank East Health Region of the country, where it was also reported that there was minimal or no flooding at all. This made the clinicians to arrive at the suspicion that they were dealing with an outbreak of acute kidney injury that might have arisen because of contamination of sources of water and food in the communities. We had seen communities where water levels were so high that they submerged the pit latrines and the wells, thereby giving rise to contamination of the sources of drinking water. The possibility of diarrhea and vomiting causing acute kidney injury was entertained. Health workers were dispatched into the communities to take water samples for analysis. It is important to note that some of these samples, when tested, yielded a type of bacterium called Escherichia coli, or E. coli for short, which is one of the commonest causes of diarrhea and vomiting in children. Severe diarrhea and vomiting by themselves can cause acute kidney injury. Some strains of E. coli can cause hemolytic uremic syndrome, which can also lead to acute kidney injury. Further analysis by sequencing of the bacterial isolates indicated the presence of Escherichia faguesoni. This bacterium also has the potential to cause hemolytic uremic syndrome, which can also cause acute kidney injury. As all this was happening, the clinicians were seeing more children with acute kidney injury. In our newly established postgraduate training program at the EFSTH, with the support of the World Bank, we have employed 16 senior doctors from the West African sub-region, including a professor of pediatric nephrology. This is a professor of kidney disease in children. We also now have a Gambian nephrologist, that's a kidney disease specialist, at the Edward Francis Small Teaching Hospital. The experience of this professor in Nigeria and the information given in other countries like Bangladesh, Panama, Pakistan, and Haiti, and others, increased the clinical judgment of the team of clinicians that the potential of contaminated medicines causing the acute injury should also be explored. This is coupled with the observation that many of these children were also given various medications for their currently existing illnesses. And many of them, these medications were also similar. These children continued their treatment. They continued to receive treatment, which included peritoneal dialysis and other medical management of their ailment. The mortality rate was, however, high. This finding was reported to the World Health Organization country office, and we also requested for support to deal with the investigations. With the help of the World Health Organization, blood and stool samples were sent to World Health Organization, that's WHO, accredited laboratories in Senegal to help in the identification of any pathogens or contaminants in the stool, blood, and medication samples that were sent together. The process was tedious, but however accompanied by rigorous follow-up. The results yielded the proof of E. coli in the stool samples, in stool samples. Two of the samples sent yielded E. coli serotype 0157, which is a cigatoxin-producing E. coli. Cigatoxin is known to cause hemolytic uremic syndrome, which can by itself also cause acute kidney injury. As the clinical correlation between children taking the medications and the worsening of their symptoms and the development of AKI became more suggestive, the Incident Management Committee advised for the suspension of the use of paracetamol syrup in the country. This was the main suspected drug because of the historical knowledge of the clinicians giving care to these patients, and the fact that about 80% of the affected children at the time had consumed paracetamol syrup. This was shortly followed by the suspension of promethazine syrup as well. This move was even criticized by many people, saying that we did not have enough evidence to do so. It, however, proved to be a good decision, as we can all tell by now. Some further drug samples were sent to Ghana for analysis. The preliminary results from Ghana indicated that out of the 9 samples sent, 1 paracetamol and 1 promethazine syrup were found to have contaminants. The paracetamol had diethylene glycol, and the promethazine had both ethylene glycol and diethylene glycol. All the samples were found to have also unknown compounds, an unknown compound. The quantification of the results showed high levels, but the paracetamol could not be further tested because the sample was said to be insufficient. However, confirmatory results could not be obtained from there. This was followed by the instruction from the Medicines Control Agency to quarantine all these products in the pharmacies and warehouses. Further analysis of the samples in Switzerland indicated that 4 of the medications had high levels of ethylene glycol and diethylene glycol. These were Markov baby cough syrup, Maghrib N cold syrup, Cofexmalin baby cough syrup, and promethazine oral solution. These were industrial chemicals that are actually toxic to the human being. They are also used in car antifreeze systems and brake fluids. The presence of these compounds in the medications is a gross violation of good manufacturing practice, as GMP. These syrups were manufactured by Maiden Pharmaceuticals in India and were imported to the Gambia by Atlantic Pharmaceutical Company. A massive withdrawal exercise of these drugs was commenced, including household recall of all syrups. A total of 50,000 bottles of the contaminated syrups were imported into the country, and out of that, 42,173 have been collected through the recall exercise so far. Distinguished Honorable Speaker and Honorable Members, our government has been working very hard over the years to reduce morbidity and mortality in the Gambia. In this vein, government has embarked upon health facility expansion, provision of more laboratories and other equipment, and massive capacity building exercises. This is yielding results, with very significant reduction in maternal mortality from 433 per 100,000 births in 2013 to 289 per 100,000 live births in 2019-2022, to a further reduction to 178 per 100,000 live births this year. A reduction of under 5 mortality from 54 per 1,000 to 49 per 1,000 in 2020. It therefore came as a big blow to have lost 70 children under the age of 7 to acute kidney injury. In 4 months, we lost this number of our children. 7 of them passed away in Senegal, where they went to seek for further treatment. A total of 82 AKI cases were diagnosed, and 12 of them recovered. This has been a very difficult moment for the families, to whom we again extend our condolences. It has equally been a very difficult time for His Excellency, the President, the entire Cabinet and Government of the Gambia, the National Assembly, because we've been interacting ever since, and you've shown how saddened you were, and to the entire people of this country, it has been a very difficult period. For the staff taking care of these patients and all other staff, it has been a traumatizing experience. Our experts and their teams worked diligently around the clock to save the lives of these patients. However, acute kidney injury in children has been found to have a very high mortality in many of our countries. During this period, peritoneal dialysis capacity was enhanced and required materials were procured. Emergency medications and equipment, including 2 hemodialysis machines for children, were also procured by government and the WHO. These have been very helpful. Throughout the period, many technical incident management meetings were held to map out the way forward. On our request, the WHO and the Center for Disease Control, United States of America, sent in technical experts at various points to support and advise. This included the WHO Africa Regional Emergency Director, the Director for Drugs and Medical Supplies at the Regional Office for Africa, the Regional Incident Management Director, causality experts, data management experts, and many more. The CDC USA sent in 4 experts, including 1 infectious disease specialist, 2 epidemiologists, and 1 anthropologist. Some of these experts are still around working with our local experts, our own experts here. They have been working diligently both in the health facilities and in the communities, collecting the relevant information and data to help in bringing this outbreak to an end, and to help determine the cause of the outbreak and also the causes of mortality. From the foregoing, it is very clear that this is not a simple process. All the possibilities or all the probabilities have to be scientifically looked into before one can conclude what the cause of death is. That actually means that this has to be established in a scientific way without doubt of the causality or causalities of death in these children. It should not be forgotten that the contaminated drugs are the most suspected, but other possibilities or other possible causes like severe diarrhea and vomiting, bacterial infections, complicated malaria are all possible causes. Distinguished Honorable Speaker and National Assembly members, the issue of counterfeit or substandard medicines is a massive global problem. It is a multi-billion-dollar entity in which some selfish individuals thrive on the suffering of other people. We got information that the Food and Drug Administration of the United States of America from 2000 up to now have withdrawn over 1,200 dangerous medications from the American market. It is a big challenge for the entire world, especially for the poor developing countries like ours, where all drugs have to be imported, and we have both limited human and material resources to detect the problem. Cases of counterfeiters doing their manufacturing in boats offshore, where no one can even identify the origin of the drugs, have been reported in some countries in other parts of the world. Upon announcing the issue of the acute kidney injury that is in the Gambia, the alert of countries around the world was increased, and this has led to the discovery of a similar phenomenon in Indonesia, where 208 cases of AKI were so far detected with a mortality of 133. Distinguished Honorable Speaker and National Assembly members, Indonesia is considered to be a middle-income country with many facilities and personnel for detecting acute kidney injury and substandard medications in their population. The fact that they had to take a cue from us here in the Gambia and even consult our team to share our experience with them. For them to deal with this problem means the team in the Gambia has really put in our best. A similar incident occurred in Haiti, where 109 children passed away. This is by no means trying to justify what happened in the country, in our country. It is just to dilate on the challenges developing countries face. It is important to note the identification of the problem and the actions our government took to stop the problems or to stop the problem are remarkable by international standards. This has potentially saved a lot of other lives. We have not seen any new case for 2 weeks in a row as I speak to you. Detecting outbreaks of this nature that have multiple possible causes is very challenging, especially for developing countries. During this outbreak, the World Bank has agreed to construct a drug and food testing laboratory for us in the country, as there is also no food testing laboratory in this country. Preliminary work has already started to this effect. Distinguished Honorable Speaker, National Assembly members, I believe that our country has been assaulted. This is an aggression against our people from greedy, unscrupulous people. The manufacturing, distribution, and importation of contaminated drugs is criminal, and government sees it that way. However, due diligence needs to be carried out to get to the root of the problem. The license of the importer has been suspended. The 2 pharmacy outlets of the importer have been closed, and the police have started the investigations in earnest. The Indian authorities have also been contacted, and we've been told that on their own, they had taken steps against the manufacturer, and this included closing their factory. And it is also stated that they found series of serious breaches in the factory. Government is on the verge of setting up a commission of inquiry into the issue. This, we believe, will help in identifying the problems and come up with recommendations to deal with the current problem and avert any future recurrences. We appeal to all, to everyone in this country, to support the government. This is a national problem. The government needs support. We need the cooperation of the citizenry so that we can collectively know who manufactured these drugs, who brought them here, and we can deal with it as a country. It is a very sensitive issue. If we deal with it in a divided manner, weaknesses will show in our efforts, and people could capitalize on that. And I think it's sensitive that we need to collectively work on it as a nation, not as different groups. This will help government, the health experts and the partner experts working together to also establish the causality or causalities of death, to assist the police in their investigations and the commission of inquiry in their deliberations. With this, inshallah, we'll get to the root of this, and I thank you very much for your kind attention.